evening. So yeah, just to thank everybody who's joined us this evening. This is the third of three public meetings that we've had online over the last week or two. The first two were on childcare and housing, and I guess we're looking at some of the most important topics of the day. So I guess I'm delighted to be joined this evening by Roisín Shortall TD. Roisín is the TD for Dublin Northwest, I'm correct, isn't it? That's the constituency, yes. And was one of the co-founders of the Social Democrats. Someone I've known from the beginning, having gotten once I've gotten involved in the party, I've known Roisín for quite a long time. So thanks so much for joining us this evening, Roisín.
My pleasure. Thanks, Ronan. Glad to be here.
So what we've been kind of doing over the last few meetings is that we just had about a half an hour of kind of a conversation around these issues and just kind of a back and forth. I guess it's one of these things that comes up so often on the doorsteps. I'd say it's probably the top issue that comes up, certainly in my own area. But I'm also conscious sometimes that people are not always as aware of the systems that we have and maybe the systems that we lack in this country. So I guess what I'd love to maybe start off with is understanding how our health service differs from other Western European countries.
Sure, and good evening, everyone. I'm delighted to be here. And great to see so much interest in issues relating to health. Ireland is very much an outlier when it comes to healthcare, and especially public healthcare. We're the only country in Europe that doesn't have a universal single-tier health service that the vast majority of people are happy to use and that can respond to people's needs. We have what's called a two-tier health service here. You'll be familiar with that. There's the public health service, and access to that is restricted enough. It's mainly based on income levels. And if you don't qualify for free public health care, then a lot of people feel that they have no choice but to take out quite expensive health insurance. And even for that cohort that, you know, about half the population or nearly half the population who have an entitlement to free healthcare. That's kind of in theory only. It's entitlement to free healthcare if it's provided. But we know that in so many aspects of the health service, when you need healthcare, that means you have to go on a waiting list in order to access public healthcare. Strangely enough, in this country, we don't have any legal right to healthcare. Say, it's quite different to, say, social welfare. Social welfare entitlement is set down in law, and every year that law is updated after the budget. And it's very clear, you know, if you have a certain income or if you're a certain age or whatever, you qualify for social welfare payments. But in relation to healthcare, there's no legal entitlement. You're eligible for free healthcare, but you're not entitled to it. And that's one of the things we want to move towards, to introduce legislation to give a legal entitlement to access to healthcare.
And can I ask, why is that? And I guess maybe also, why is it that, unlike so many other Western countries, we don't have that universal healthcare system? Is there reasons for that, and are there reasons why that continues to be reinforced?
Yeah, I think there's a few different reasons. You know, I suppose our nearest neighbour in the UK I think we'd all be fairly familiar with the NHS. And, you know, I think people in the UK are very proud of the NHS, even though in recent years with Conservative governments, the funding has been cut a lot. But even still, they're very proud of it. And about 90% of people in the UK are quite happy to use the NHS. So it's really only very wealthy people who take out private health insurance because really they want kind of 5-star accommodation standards in hospitals, you know, in private hospitals. But the vast majority of people are happy to use the public service. Now, it's very different here. And when you think that the NHS was set up 76 years ago, after the war in the UK, and Nye Bevan was the name of the Minister for Health, and he was a socialist, and he was very committed to the whole idea of the welfare state, and that, you know, lessons were learned after the Second World War, and there was a sense that, you know, if we're to be a successful country, we need to have a safety net. We need to ensure that, you know, there's good quality welfare systems, and also that in terms of health, it's a very fundamental service that we need. All of us need it in our lives. And they took that decision to introduce a free healthcare system, free at the point of delivery. And that was 76 years ago. In this country, around the same time, around 1947, 48, the late Noel Brown, who was a Minister for Health at the time, he saw what was happening in the NHS and he wanted to do something similar here in this country. And he started off by wanting to introduce free healthcare for mothers and children up to 16 years of age. The Mother and Child Scheme, it was called, very famous scheme, because it led to a lot of political kind of unrest. And he wanted to introduce that scheme, but it was very much opposed, first of all, by the Catholic Church. Archbishop John Charles McQuaid called in Noel Brown and warned him that he couldn't introduce a system like that because it would interfere with family values. That's the argument that was made at the time. And then very quickly after that, then a lot of the medical profession came to oppose it. The Irish Medical Organisation officially opposed that scheme because they saw that as threatening their income. So it was a combination of Catholic Church, which was obviously very, very powerful in those days, in the 40s, and the medical profession joined ranks. And really, as a result of weak politicians at the time, they, very much gave in to those pressures. And we still, 75, 76 years later, we still don't have the Mother and Child Scheme, let alone having free access to healthcare right across the board for all populations. So I suppose there were vested interests in this country that very much opposed the idea of universal healthcare. And a lot of those interests still remain there. And, healthcare can be very lucrative for people who see it as a business. And there's a lot of opposition to making it freely available because, a lot of different people are making a lot of money out of it.
It's interesting, as you say, with the UK as an example, because quite often UK is associated with kind of a class kind of based system and kind of wealth, and even in the education system, the public-private exists there so strongly. But when it comes to the private system of healthcare, it's a very, very small percentage of people, as you say, who avail of that, because I know the Conservatives have done great damage to it over the last number of years, but it's still a service that people really are a great sense of pride. In terms then of the system, so this public-private model that we then continue to have in the country, like the effects of that, I think maybe you might explain some of the effects of it, because what I'm seeing and continue to see, and it's been the case for the last number of years, is just the waiting list that then exists within our own model at the moment, and that don't seem to abate. What are they the type of issues that we continue to see and will see, and are there other problems as well that arise?
Okay, I should say when I was talking about the UK that they were the first country in Europe to introduce a universal single-tier health service. And after that, then all of the other European countries introduced some form of universal healthcare, where people could access healthcare when they needed it rather than how much they had in their pocket. And there's different kind of systems. They're all universal, but some of them are funded, through tax money. Some of them are funded through an insurance type system, a social insurance type system that would be run by the government. And people have, it's an obligatory insurance system. Sometimes, say in Germany, that's deducted from people's pay packets. And those who aren't working, then the state makes a contribution. So across the board, there are universal systems. So you asked me there, what has been happening kind of since then, and why have we got to the point where there's such division within the health service and such need? And the reality is that, we have this two-tier system and it doesn't work for us at all. And it's kind of all or nothing. You're either in the public system or you're in the private system. And of course, the public system is not adequately funded. And because it's not adequately funded, then people worry about what happens if they get sick, what happens if they have to have an operation, what happens if they have a heart attack. And a lot of people feel they've no choice but to take out that expensive health insurance. And it's actually like another health tax.
Yeah.
You know, it's very expensive now, and it is getting more and more expensive. And the more that that happens, and the more that you see that, you know, all of those interests in private healthcare, you know, from insurance companies, private hospitals, hospital consultants, a whole lot of different interests encouraging that kind of private model of healthcare. And the more that goes on, the less funding is put into ensuring that the public system works. And of course, the other really odd thing about the system here in this country is that it's not that you have a separation of public and private. You know, you have a situation where private patients could go into public hospitals, and hospital consultants would share their time between public and private. And like that just didn't work at all. And it was very much incentivized towards the private model of healthcare. And we're trying to change that. I mean, health has been a huge issue in this country. Long waiting lists for general healthcare if you need to go into hospital, generally speaking, long waits to see a consultant, long waits then to go in and have your procedure. And equally, there's, apart from the fact that there's about 800,000 or 900,000 people on hospital waiting lists of one kind or another to see a consultant or to get a procedure. But there's then hidden waiting lists for the community services, you know, things like physiotherapy, public health nurses, speech and language therapists, all of those really essential community services, the therapies in the main. There's about 300,000 people on waiting lists for those. And a huge number of those are waiting longer than a year. So there's a very high level of unmet need. And that's why I suppose healthcare has been a bit of a political football down through the years. And there was no agreed system or the, you know, model of healthcare, whereas other countries would have agreed that they needed a universal system. And the question was what kind of funding model you'd have for that. But we never had that debate in this country where, you know, politicians and other interests said, what kind of health system do we need to serve this country and to meet people's needs? And it wasn't really till very recently that that debate took place.
Yeah, and I'll come to that in a moment but just to touch upon, because that's very much the issues that you hear on the doorstep. That you mentioned kind of this idea of a second tax. Like we spend a huge amount of our annual budget every year on our public health system, but yet people, as you say, are so fearful of getting sick and ending up on somewhere on the waiting list that for many people, if they can afford it, they pay for the private healthcare system. And then likewise, in terms of those other waiting lists, those hidden waiting lists that you mentioned, I think one of the kind of worst, the saddest stories that you hear on the doorstep is very much from people, particularly of children who are waiting to get some sort of early intervention. And sometimes that child is growing past that stage where that intervention would really have those great benefits. They have been unable to access the private healthcare system to do so. They don't have the money. And then the overall cost to the child, to the state, to the education, to the schools, are so vast. But to bring them towards kind of a solution, because you mentioned about this idea that it's a political football, and every I guess growing up, you'd hear the would-be health minister from whichever party is going forward, and they would say, well, if I became the health minister, this is the plan that I would bring forward, and someone else saying the same thing. But that brings us to Sláinte Care, which I know you were a key part of that, where the way I understand it, it's like the first time in our nation's history where we had cross-party agreement towards a health strategy. Could you explain, I guess, the importance of Sláinte Care and what it could mean for us as a country?
Sure. Well, as you say, up to kind of recent years, every time there's an election and a new Minister for Health, there'd be a new plan. And of course, you know, the plan would be opposed by the opposition and the plan never worked. So there was this constant churning of, you know, policy in relation to health. And in the 2016 election, I remember health was the #1 issue on the doorsteps. And after the election, there wasn't an obvious majority for government, and there were a lot of talks going on in the background. And it took several months before a new government was in place. And at that stage, myself and others in the Social Democrats, we said, look, here's an opportunity to think about doing something. And we really need to get Ireland into line with the rest of Europe. A universal single-tier health service where people could access healthcare on the basis of need rather than their ability to pay. So we drew up this motion for the Dáil, setting out, a proposal to set up a cross-party committee that would get us from the point that we were at with a two-tier health service to a single-tier health service, and plan out that route and the kind of changes that would need to take place. And we put that motion to a number of TDs, and we got a majority of TDs in favour of it. And then when Fine Gael formed the government, it was minority government, they had no choice really but to go along with that, because we already had a majority in favour of it. So they signed up to it, and there was a very good debate in the Dáil. And as you say, for the first time ever, we had an agreed healthcare plan, and agreed by every single party that we would set up this committee to design the new scheme. And there were 14 TDs from all different parties nominated to that healthcare committee, and I was the chair of it. And it was a fantastic experience, and it was really good work done. We sat for a year. So every week we met for 3 or 4 hours for a year and hammered out all of the steps that would need to be taken to get us to that point of being like the rest of Europe and having a properly functioning public health service. So we worked away on that. We had patient groups in, we had staff, all kinds of different staff from the health system in talking to us. And the vast majority of healthcare workers wanted that model of a single-tier health service. And we got in experts from Ireland and from abroad. And really, all of those 14 TDs came with different views. But when we heard the evidence of what works in other countries, people did reach an agreement on the kind of model we needed here. So we published that report. That was 2017. And it set out a 10-year plan for us to get from the two-tier system to the single-tier system. So, 2017 should be the year, it was the year that it started, and in 2027, that should be fully implemented. Unfortunately, things didn't go as clearly as they were expected. We did have COVID in the meantime, which kind of was a loss of about 2 years. Also, I think the Fine Gael minister at the time, Simon Harris, the current Taoiseach, thought this is just a plan that would be left to gather dust like any other plan. And while he used to talk about it a lot, there wasn't that much action taken. But I have to say, in recent years, there's been a lot of pressure put on, especially from the Health Committee in the Dáil, to make sure that the Sláintecare plan is implemented. So we're now 7 years into it, and we're beginning to see progress. There's a lot of work going on behind the scenes, and I think that will bear fruit in the coming year or two. But I suppose in terms of tangible things that people have seen, it is the case that a lot of the costs for accessing healthcare have been reduced, and that's very welcome. A lot of additional people now have access to free GP care. I mean, you have to bear in mind that what Sláintecare is about having free access to primary care and to hospital care. So cost is a huge barrier to people getting access, and we need to reduce those costs. So, things like prescription charges have gone down. The drug payment scheme has been reduced. More people, as I say, have access to GP care. Now, that's all very good as an initial thing, but there's a lot further to go. And we haven't got to the point where, for example, access to speech and language therapy or public health nursing is free across the board. And there's one thing making it free. It's the other thing that has to be done is that there has to be capacity created within the health system so that people have access to services, and that means having enough staff there. And unfortunately, one of the problems we're encountering at the moment is that we've seen in the last couple of years where money is provided for additional services in primary care, But very often that money can't be spent because there's a problem in recruiting staff.
Yeah.
And, you need, the problem there is that there hasn't been proper planning for workforce demands. So, we need to look at the growth in the population, what's that projected to be over the coming years, and then make sure that we have enough training places in the universities. We're training enough doctors and nurses and therapists to meet the demand that's there. So there's a lot of things happening at the same time there. And the other thing I just mentioned is that the HSE hasn't been very successful as an organisation. It's a huge organisation. It has a massive budget, but it doesn't function terribly well. It's very centralised. And what we're proposing under Sláintecare, and this is happening at the moment, it's the restructuring of the HSE so that the country is divided into 6 areas. And instead of what we've had up to recently, where hospitals are organised in one way and the community services are organised in the other way, and they've different boundaries and they're not integrated. And integrated care is very important. So the hospitals get their own budget and the community services get theirs, and they don't interact. So the whole idea of having the 6 areas means that there'll be just one management team in each of those and one budget. So the kind of ridiculous things that we've seen, where maybe at any one time there'd be 500 or 600 people in the acute hospitals ready to be discharged, but there's no money for home care. And those hospital beds are taken up, and the people who should be back at home with support aren't back at home, so they're not doing as well. So that kind of thing shouldn't happen in the future. Money will be spent where it makes most sense. And the other important thing, I think, about the restructuring of the HSE, where there'll be 6 areas, and Meath will be in Area A with the north side of Dublin and Cavan, Monaghan. The important thing about it is that each of those 6 areas will get funding according to their need. Now, what that means is the funding will be allocated based on the population, the age of the population, the socioeconomic profile, recognising high levels of poverty in different areas. And funding will be allocated that way, because in the past, too often what happened was that if you had a minister in your area, you'd get funding for healthcare. And it shouldn't be like that. That's the wrong way to allocate resources. And that's why we have this kind of postcode lottery now with healthcare. Services are good in one part of the country, they're terrible in another part. So we want to equalise the services so everybody has an equal access to good quality healthcare.
I think that's one of the things that actually impacts people a lot or hurts people a lot, is the feeling of injustice, as you say, where they feel some locations are getting services while they themselves are not. And if it's evidence-based and if it's led by, as you say, the data, that's what makes the big difference. One of the things at the last election that I was struck with was the idea that at times when the debates got onto the topic of health, by and large, you had TDs across the board, or the leaders across the board, all agreeing on this Sláintecare model, which was really good because, again, the way you explained, when people have bought into it, well, then it's a matter of actually just how well you can execute the plan. And then you explained some of the problems with the execution. Conscious of time, maybe the last 5 minutes, but then as a question then, you've mentioned about some of the advancement that Sláintecare has helped to bring in, which to show that it is working, albeit not at the pace we might like. With the Social Democrats in over a health ministry or involved in a government, would there be any either tangible expectations you'd feel that the people themselves might experience over the next 5 years if that was to happen, or even just within the health system that you feel would need to be guaranteed and that you think like a Social Democrats could guarantee in terms of executing it if in government?
Yeah, sure. I mean, this is a top priority for the Social Democrats, because we just believe in it so strongly, and there's no reason why people in Ireland don't have the same kind of access and rights to healthcare as people in the rest of Europe. So we're completely out of line, and we need to come into line with what's happening in Europe. And we need to take cost out of this for the patient or the user of the service. So what we'd like to see is, first of all, legislation to give people a legal entitlement to healthcare. Okay, that's a starting point. The next one is that we want to fully fund digitalization within healthcare, because it's very hard to actually get good data in relation to healthcare. And we need to know, for example, how effective and how productive are hospitals, because they're not all the same. Some of them, give very good value for money. Others don't, and we don't measure that very well. And we are spending so much on it, as you say. It's next year we'll be spending about 26 billion euro, and we need to ensure we're getting value for money from that. I think a very important thing is that point that I mentioned, that we need a proper workforce plan. And we need to assure people working in the health system that they're not going to be left carrying the can in situations that are very pressured and where, there isn't sufficient staff, and then they suffer from burnout. And that's a kind of vicious cycle. So we need to treat our healthcare workers with respect, and we need to ensure adequate staffing levels. From the patient's perspective, there has to be that guarantee that they have access to healthcare when they need it. And increasingly, what we're trying to do is to ensure that more and more healthcare will be provided in the community, and that there be a much better focus on chronic illness, those common illnesses like diabetes, asthma, COPD. And a very large proportion of the population have those, what are called, that are chronic illnesses. And people shouldn't ever have to go to hospital to have those seen to. Chronic illnesses should be managed in the community. And that means going to your local GP, going to your primary care centre, and having access to the kind of specialist nurses that will do your bloods and, check your weight and all of those kind of things. So the aim should be a healthcare system, not a system for treating sickness. And too often the Irish healthcare system has been about sickness rather than health. And another point just I would make finally is there are two things that impact our quality of life and our health very much, and impact our life expectancy. And that is the social determinants of health. So people on lower incomes have a lower standard of healthcare, and they have a lower standard of health. The life expectancy of people on very low incomes is about 8 or 9 years less than that of people who are more comfortably off. And the other thing which I'd really like to see us tackling in a serious way is what are called the commercial determinants of health. And that is the enormous pressure that is put on families to buy junk food. And the fact that, councils allow umpteen, fast food, junk food outlets within local communities. We need to stop that, and we need to take away that kind of pressure from advertising and widespread availability, especially for children, so that, we can get into the way of living as healthy a life as possible, eating decent food, and taking responsibility for our own health as well. But when things go wrong, when conditions develop, that we get early access to care. That's the key thing. When you have a developing condition, the earlier you get access to care, the better, and the better chance you have of, survival in full health. So it's that kind of combination of things, services there when you need them, in removing cost as a barrier, but also encouraging people through changes in the law, for example, in relation to the quality of food that's available and the cost of good quality food for people. So there's a whole lot of things like that that we can do as a society, and that has to be led by government. And I really would love to see the Social Democrats leading on that. We've taken a very strong stand in respect of healthcare. We have developed the Sláinte Care model. We believe that that will deliver for people a much, much better healthcare system and a much better quality of life for them. And we'll certainly be making that very much a red line in terms of entering government. We are keen to get into government, but we will want to see Sláinte Care and another number of issues delivered. So that's our position on it.
Roisin, thanks so much. And that brings us to the half hour as well. And I couldn't get a more comprehensive overview of both this position we currently are in, where we came from, and also, I guess, our ambition and hopes for the future. Thanks so much for joining us this evening. Really
Thank
do
you.
appreciate taking the time out. And I'm going to finish up by just thanking everybody again at home for tuning in, and want to wish everybody a safe and enjoyable night.